With the kickoff of a new year, our DHS divisions saw new opportunities in 2019. And the Division of Child Care and Early Childhood Education started by setting the bar high, announcing a $3.5 million grant to help better serve children who experience trauma and provide professional development to those who teach and care for Arkansas's youngest learners. Moving forward in our promises of reform, DYS closed the Colt Juvenile Treatment Center and continued making capital improvements to its other treatment centers. After a lot of work, a revised AR Choices program and rule went live in Arkansas. The goal to focus on the functional needs of aging adults and those with physical disabilities and how they can be better served in home and community-based settings. All the while, preparations were underway for the start of the Arkansas legislative session. Being an agency that touches so many Arkansans, DHS staff were frequently called to attend legislative hearings, give insight on the impact of bills, and work with legislative partners to make reforms to laws where needed. DABA staff took on the challenge of overhauling its forensics program, to include a move toward dashboards for tracking from a manual process, a new effort to keep judges informed, and a new way for people involved in the criminal justice system to get mental health services without a forensic evaluation. We also celebrated the grand opening of the Blue Umbrella, a gift shop open year-round that sells handmade items from DDS clients living in our 5 human development centers and out in the community. March was a big month for making strides in serving those with developmental disabilities. The PASS system went live, where the passes moved beyond care coordination to full management of clients' health needs. During the process, there were certainly challenges, but with round-the-clock work by DDS and DMS, the program improved and moved forward. While DHS divisions and offices had been using dashboards for months to manage performance, we decided to make our commitment to accountability a public endeavor. We launched the DHS Performance Center, where members of the public can track our operations data, read our required reports, and monitor our program performance using the same tools that staff use. April marked another huge showing of support for preventing child abuse in Arkansas through the DCFS Annual Child Abuse Prevention Rally at the state capitol. DIPSQA also stepped in to help DMS as it worked through a backlog of provider enrollment applications and revalidations. DCO and IT, meanwhile, got underway on a major infrastructure modernization project to create a single eligibility system for Medicaid, SNAP, child care, and T programs that could serve as the technological backbone for other services. And speaking of technology, DABA and the Office of the Drug Director launched the Narcansaw app. It includes instructions on how to give Narcan to someone who is overdosed with the goal of saving lives, plus recovery resources to get them help afterward in addressing the opioid epidemic. Arkansas lawmakers adjourned the legislative session. Overall, more than 170 bills touching DHS were passed, which would eventually require thousands of rule changes over the coming months. May kicked off with an amazing Walk for the Waiting fundraiser, complemented with Change for a Change and our annual yard sale, for a total raised by DCFS of $18,964 to help support our community partners in caring for children who enter foster care and those waiting for a forever home. Mother Nature threw us a few curveballs in May, with major flooding across the state requiring activation of our ESF 6 emergency response teams to help our partners in managing the crisis and meeting the needs of affected Arkansans. DHS didn't go unscathed. Threats of floodwaters required us to temporarily close the Pulaski East office and relocate staff. That closure would turn permanent as the waters receded, and we discovered we could reinvest rent money and other overhead expenses and continue to serve the residents of Pulaski County with one less physical office space. By June, the heat was on and school was out. Our DCCECE summer feeding programs were underway, and over the summer they would serve thousands of meals through more than 100 providers at over 400 sites. Integrity efforts also ensured that resources and funds were truly connecting to those in need, while the Health and Nutrition Unit was able to close previous USDA management evaluation findings in the division's nutrition program. The Blue Umbrella Farmers Market kicked off in June, followed by one each month throughout the summer. DHS staff, our downtown neighbors, members of the community, and even members of Congress connected with clients and our DHS mission during these fun events. DYS ended the month by closing a second juvenile treatment center, this one in Dermont, making a smooth transition for all the youth who left the facility and returned home or to other centers. With the end of fiscal year 2019 and the start of fiscal year 2020, DYS also made the move to return its facilities to private management, while also launching a new community texting tool to keep the public informed about youth who leave without authorization. At the same time, it worked to address growing problems with that issue. After a year of operating the Outpatient Behavioral Health Services program, DABA celebrated huge growth in the number of mental health providers and access to services, with behavioral health agencies increasing from 253 in 2017 to 311, and individually licensed practitioners growing from 31 in 2017 to 207 in 2019. Governor Hutchinson and First Lady Susan Hutchinson helped us celebrate our Foster Parents of the Year by welcoming us for a wonderful evening at the Governor's Mansion. Ashley and David Daniel were chosen as the statewide winners because of their commitment to reunification, serving teens in foster care, and being mentors to other foster parents. July also marked moves for some of our colleagues as state agencies worked to realign as part of the governor's plan for executive transformation. AmeriCorps and the Division of Services for the Blind joined other agencies, while DYS gained C-STEP, a behavioral management program for young men. By August, DDS had fully implemented its EIDT program to serve children with developmental disabilities and complex medical needs in educational clinics. DHS also celebrated a year since we announced a reinforced commitment to integrity in our department. That effort included monthly Let's Talk Integrity sessions that have covered a wide range of topics, from mandated reporting requirements and do's and don'ts of accepting gifts to how customer service relates to integrity for us all. With its commitment to making treatment for mental health and substance use disorders accessible to clients, Governor Hutchinson was excited to announce that DABA had launched its mental health support line.
We have this helpline that will be available to the citizens across the state for proper referral to a local community health provider.
In September, DABA and the Drug Director's Office hosted the first regional peer recovery conference, bringing hundreds of people from across the nation to panels and breakout sessions on best practices to support and help those dealing with mental health and substance use disorders. The Division of Provider Services and Quality Assurance also gained a new director. Jerry Sharam moved from the Office of Chief Counsel to take over the division.
DHS is me.
And the Office of Human Resources launching a major rebrand of its recruiting efforts to recruit a wider range of new employees to DHS and highlight the perks of working in a place where you can pursue your passion, start here, and grow here. A place where employees see their values reflected in the work they do. At the beginning of October, DIPSQA had to step in to ensure client safety at 2 nursing homes by seeking receivership of those facilities as they ran low on food, supplies, and funding. A few days later, that number would grow to 5 facilities in all. DIPSQA staff monitored the operations of those facilities and coordinated with dedicated staff to keep residents safe during the uncertainty the owner was experiencing. DCFS also released its annual report of progress in reforming the child welfare system. Family First Fits Us highlighted how a historic federal law aligned with the division's vision of strengthening families and getting children into stable, safe homes faster. With support from divisions and offices across the agency, DCFS reported major strides in areas that had been in crisis just a few years earlier. An increase in children being placed with relatives, a decrease in the number of children coming into care, and progress on average caseloads and the number of foster homes recruited across the state. And speaking of children, hundreds of kiddos from Central Arkansas came to visit DHS staff during the 4th annual Halloween event. Willy Wonka, Star Wars, Toy Story, Harry Potter, The Lion King, and The Addams Family, just a few booths on the trick-or-treat tour that gave children sweets and maybe a few friendly scares. DHS also celebrated its model employees along with the Arkansas Human Services Employee Association during October, acknowledging the hard work, innovation, and dedication to service across our offices and divisions. Julie McLaughlin, named Employee of the Year, and the Secretary's Conference Room was renamed in her honor. During our Veterans Day event, General Don Morrow, retired Adjutant General for Arkansas, honored us as the keynote speaker, highlighting a commitment to lifelong service in the armed services and civilian roles. The colors, presented by students in DYS's C-STEP Color Guard Brigade, And we added more than 60 portraits to our Veterans Wall of Honor of those who have served or are serving in the armed forces and continue to serve in their roles at DHS. DCCECE walking the walk on supporting parents and improving childhood experiences. By November, the division had hosted more than 342 trainings in 41 counties, with nearly 5,000 parents participating to get helpful tips on parenting skills and child development. The Polar Express at Conway Human Development Center, bringing smiles to residents' faces and bringing visitors from out in the community to our campus to celebrate with clients. A parade of Santas helping out while St. Nick was up at the North Pole close to Christmas brought some holiday joy to the residents at the Arkansas Health Center as well. Medicaid continued to transform its programs and ended the year on track toward its 5-year savings goal. We've accomplished a lot of goals, overcome a lot of challenges, and created a year full of opportunities. Now that we've taken a look back, we're setting our sights forward on what the next year holds.
DHS is me.
And DHS can be you too.